Good evening, everyone. Thank you so much for joining us once again for another in our well-being webinar series. We're very pleased to welcome you. I'm Amy Liebman, President of NTM Info and Research, and I will be your host and moderator for this evening. We are very pleased to welcome back Dr. Devon Smith from National Jewish Health. Today's topic is caregiver stress. Dr. Smith is a licensed clinical psychologist with more than a decade of experience researching and treating mental health concerns and psychosocial factors unique to chronic illness. She received her bachelor's degree in psychology at Oklahoma State University before completing a clinical psychology PhD program at Washington State University with an emphasis in health psychology. During her training and throughout her career, she has provided health psychology interventions in a variety of settings, including oncology, primary care, internal medicine, cardiology, pulmonology, and infectious disease. She received specialty training in sleep treatment while working at the Georgia Cancer Center for 2 years, and in 2018 was recruited for a faculty position at Augusta University Medical College of Georgia, which involved creating a behavioral sleep medicine clinic. Currently, she's an assistant professor at National Jewish Health in Denver, Colorado, and works within the sleep medicine and NTM fields. Dr. Smith, thank you so much for joining us today. We are welcoming you back. We're very excited for your presentation. Today, for the presentation, you can post your questions into the Q&A. You type them into the box, hit send, and they will post in there. And when Devon is done with her presentations, I will start reading out the questions in the queue. You can also hit send anonymously in the bottom and post your questions anonymously. And there also is a chat function. So as we go through and people have comments and Dr. Smith asks us questions, you can also comment in the chat area as well. We'd like to thank INSMED for their support of our programming. Without their support and the support of people like you, we could not continue to bring this valuable programming to you, and it's our pleasure to do so. Thank you, everybody, for continuing to support us. Don't forget to follow us on social media. We're on Facebook, Twitter, LinkedIn, and Instagram, and you can learn more about our programs and sign up for the latest news at ntminfo.org. Dr. Smith, thank you for joining us. Welcome, and please take it away. The floor is yours.
Great, thank you. So I'm going to go share my screen here. All right, can you see this okay?
Yes, we can.
Perfect. Okay. So today I'm going to talk a little bit about caregiver stress. It was one of the topics that I was asked to speak on. And so, this might be something of interest in particular to certain individuals. Certainly with chronic illness, it's definitely something to consider. So what I'm going to go over today is I'm going to talk a little bit about what exactly caregiver stress is. I think it always helps to have a definition out there and to know exactly what we're talking about. And then I'm going to talk a little bit about signs and symptoms of caregiver stress, so how to acknowledge or realize when it's happening, ways that this type of stress can impact caregivers, ways to prevent caregiver stress, but also ways to cope with caregiver stress, because, as much as we might try to prevent stress, it's, undoubtedly going to happen. So what do we do when it does? And so before we get started into this specific information, I wanted to ask everyone that's here today a little bit about who's in attendance. So I'm curious, if you want to launch the poll, Amy, if you're someone that's living with NTM, but you're not a caregiver, if you're someone who has a loved one with NTM, so you're a caregiver, maybe both of you are here, so someone living with NTM and someone who has a loved one with NTM, or if you're someone living with NTM, but also providing care for a loved one with some sort of illness or injury. And so if you want to go ahead and let me know who's here today, that'll just help me kind of tailor the talk a little bit. So Amy, I think you can see as people answer, like how many people have answered.
Yes, and we'll give it, I think, another 10 or 15 seconds to let people answer, and then I'll end the poll and the results will show up on the screen.
Sounds good, thank you.
Okay, all right, I'm going to go ahead and close the poll.
Okay. All right, so a lot of you, so most of you are someone, you have NTM, but you're also providing care for a loved one. Some of you are living with NTM, and then a few of you are someone with a loved one with NTM. So yeah, I think this is a good mix of people in terms of, information, because this isn't just, about NTM, this is about caregiver stress in general. And so one of the things that, we'll talk about is what exactly is a caregiver. So just basic definition is anyone who provides care for another person in need. So this doesn't have to be a medical provider, they're in the caregiving field, but really what we're looking at today is informal caregivers. So these are friends or family who are not paid to give care, but are helping people deal or manage injury, illness, disability. And so caregivers come in many different forms. So, this could be a son or a daughter. This could be a friend caring for a friend. This could be a parent caring for a child, a husband caring for a wife, or vice versa, a spouse caring for a spouse. So really, it's just anyone providing care for someone in their life that's not paid. So that's going to be the aspect we're focusing on. Most Americans will be informal caregivers at some point in their lives. So a 2012 survey, so now, 10 years ago, found that 36% of Americans provided this type of unpaid care to another individual within the past year. And so that was just a 1-year framework. And so if you're thinking about from year to year, most of us are taking on some sort of caregiving duty at some point. And so I'll talk more about this, but caregiving can absolutely be rewarding. It's not just a negative thing. So I don't want this to be framed in an overly negative way. There's definitely advantages for both the individual receiving care as well as the individual giving the care. And so I definitely want to highlight that as well. But caregiver stress is a unique type of stress. So the physical, mental, emotional stress that caregivers often experience. And so the thing I want to highlight here is that this is often due to a person neglecting their own physical and emotional health because they're so focused on another individual. So I really like to highlight that this isn't about the person with the chronic illness that's causing the stress. This is often a result of neglecting your own needs as you're a caregiver. And so that's really what I'm going to highlight today. Isn't so much, someone's a burden or, providing the care is what's totally draining a person. It's really when we neglect our own needs where we start to run into some issues. Interestingly, there's been some research that shows that women are especially at risk for harmful health effects of caregiving stress. And so I think that's just something to consider, is that women are at higher risk for health problems. So particularly women caring for someone with Alzheimer's or dementia. There's a lot of research out there about that and how women just tend to overlook their needs when, really providing care for other people. So keeping that in mind as we talk about this. So kind of like I highlighted here, but caregiving can definitely be rewarding. Most of us want to help our loved ones. So when someone's in need, we want to be that support person. It feels good to be able to provide that care, but there's definitely ups and downs with it. Sometimes spending time together can give new meaning to your relationship, especially, like caring for a family member or friend, it absolutely can be rewarding, but there are things to keep note of in case your cup starts to run empty. And so we'll talk about that. So some signs and symptoms of caregiver stress: feeling overwhelmed. So not just by providing care, but just in day-to-day, feeling overwhelmed with decisions, feeling overwhelmed with providing care, feeling alone or isolated. So that can look two ways. Either, you feel that way despite being surrounded by other people, or you're tending to isolate more. So if you're a caregiver, you're kind of pulling back from the other people in your life. Sleeping changes, so either sleeping too much or too little, appetite or weight changes, feeling tired most of the time. And so there's two different types here. This could be feeling fatigued, like just feeling really low energy, or it could be actually feeling sleepy, like you're not getting enough sleep, you're dozing, you're really struggling in terms of sleepiness. So it could look two ways. Losing interest in activities you used to enjoy. So this isn't just because you don't have time to do these activities, it's that you're not interested. It's just really not bringing you the same level of pleasure that it used to. So that's definitely a sign that maybe you're under some stress that warrants some attention. Becoming easily irritated or angered. This can even be with yourself. I always point that out when we talk about irritability. It doesn't necessarily mean you're irritable towards other people, although it certainly can. It can also be like you're just, you drop your phone and you're just, frustrated and more irritable about it than usual. You lose your keys and you're just really pissed about it. Like having that kind of trigger emotional reaction can be definitely a sign of stress. Feeling worried or sad often. So it's not abnormal to feel worried or sad in situations when chronic health issues come into play, whether it's for yourself or others. It's really about, is that emotionality, is it prolonged and persistent? So those are the two things that I like to highlight when we talk about feeling worried or sad. Is it something that's lasting a long time? So not just you're sad one day, but you're sad for weeks. And is it persistent? So it's not really going away. It's not really changing. You don't wake up feeling better. You feel the same or worse every day. And so I, definitely don't want to say that you won't experience sadness or worry. Those are two normal things to experience, but it's, if it's causing you distress and it's becoming prolonged and persistent. And then also having headaches or body aches. So that's a real good indicator of a sign of stress, is that you're just not comfortable in your body. So sometimes our bodies show us this stress before our minds do. And so paying attention to what's going on in your body, because our head and our body are connected. Sometimes we forget that. So what goes on in one impacts the other and vice versa. And so just quickly, some ways that stress can affect caregivers. So there's research on all of this, but and this actually isn't unique to caregiver stress. This is stress in general has been linked to a lot of these different things, but definitely depression and anxiety. And so that can be symptoms, right? Like, so feeling down and sad or feeling anxious to be a clinical condition. So that's more when you get into the territory of prolonged and persistent. It's causing you a lot of distress. It's impairing your day-to-day functioning. You're worrying so much. It's really wearing you down. You're so sad. You're so down or irritable that it's getting in the way of your day-to-day. That's more of the clinical side of things. So women who are caregivers are more likely than men to develop symptoms of anxiety and depression. Whenever we talk about women experiencing symptoms more than men in terms of emotional or mental health types issues, there's always the question of, are women just more likely to report this? But this has been shown in the research. Memory and attention issues. So stress does impact our cognitive functioning. Interestingly, caregivers of spouses with Alzheimer's are at higher risk for problems with short-term memory and focusing. So again, Alzheimer's tends to be a really difficult condition for people to watch a loved one suffer with, but also to provide that around-the-clock kind of care. Weakened immune system. So caregivers may have weaker immune systems and spend more days sick with things like cold or flu. But again, this is also very common with chronic stress. So it's not unique to caregivers. And then risk of chronic diseases. So high levels of stress in general, especially when you combine it with mental health concerns like depression, you raise the risk of health problems such as heart disease, arthritis, diabetes, all sorts of different conditions that can be risky if you kind of let that stress run unchecked. So I presented on stress management in general a few months ago, and so you can definitely check that recording out. But I covered that in that other presentation. But there are effects of long-term stress for anyone, and so long-term stress is stress that doesn't resolve in a neat and orderly time frame. It's something that's long lasting, or it's little stressors that just build and build over time. And so it starts to feel really overwhelming. And so if you're dealing with chronic or long-term stress, which often can come with a chronic illness, you may experience certain changes in your health and your physical health, your mental health. And these are all things that have been linked in the research. So for people with NTM, you can have lung complications, difficulty breathing, some exacerbation of existing conditions. For anyone with diabetes, your insulin regulation can change. Something I really highlight a lot with my patients is pain can worsen. And so, even if it's just daily aches and pains, it can feel a lot worse. You can have flare-ups if you're under a lot of stress. I compare it to, imagine if you had a pre-existing bruise on your body, and you hit it with a hammer. If you hit it with a hammer, it's going to hurt regardless, but it's going to hurt a lot worse if you have that bruise there. So when you're under a lot of stress, that pain is going to hurt even worse. There's some inflammation that can happen, weakened immune system, like I mentioned, that increased risk of mood and anxiety symptoms, memory changes. So again, just issues that we see with long-term stress, in case anyone was wondering why it's important to deal with these things. There are actual consequences related to it. I think a lot of times people are feeling like they need to just, kind of put their head down and deal with it. And, that actually can have some real consequences for people. So talking a little bit about prevention tips and coping with caregiver burnout or stress. I think one of the things to realize here, and I already kind of highlighted it, but is, finding the cause of this stress. So a lot of times it's, a lack of prioritizing your own needs when it comes to, your interests, your needs, your physical health, your mental health. Sometimes it's related to unrealistic expectations. And so really what that means is like, I have to handle it all myself. That's an unrealistic expectation. There's no one can handle, everything themselves. We all need help from time to time. So looking at your expectations and recognizing, is this something that is a fact, or is this something that I'm telling myself? Lack of support from family. So if you're dealing with this on an iceberg, all on your own, that's going to create some stress. And then juggling multiple commitments. So people that may be dealing with work and providing care, or, other responsibilities in providing care. And so I already mentioned these kind of signs of they're calling it burnout here, but it's also known as caregiver stress. And so prevention tips, setting realistic expectations for yourself. So maybe you can't do it all, but what can you do? What's realistic for you to do in this situation? Sometimes we're providing care, we're providing too much care sometimes. So we can actually start taking over other people's, daily activities without really being asked to do it. We step into a role, and now we have all these expectations on ourselves that were never really, put on our plate to begin with. So looking at what your expectations are, what are your actual tasks, what can you do, and what can you delegate? It says embracing your role as a caregiver. So I think really what that means is finding the positive. In any situation, there can be lots of negatives, but there can be some positives too. So trying to find that silver lining, even, not negating any negative emotions you may have around it, but also balancing it with some positives. We'll talk about this for a number of slides, but practicing self-care. There's some great caregiver support groups out there. Taking regular breaks, that's so important. A lot of caregivers just go throughout, an entire day without any time for themselves. So really taking aside, making it a priority to take that time for yourself, even if it's 5 or 10 minutes. And so talking a little bit more about relieving caregiver stress, when it happens, when maybe you haven't prevented it, and excuse my cat in the background, she can't be stopped, so she's just going to be there for this. So some general tips, learn about your loved one's illness and ways to better help. And so it's really important to utilize resources to understand NTM if you're a caregiver. Or if you're not a caregiver for someone with NTM, if you're a caregiver for someone with a different condition, understanding that condition doesn't mean you have to get a graduate degree and, everything involved in this condition, but maybe go with your loved one to an appointment. If they have a specialty, treatment or something like that, going with them and understanding what all is involved. Having a better idea of what the treatments are like can help you know what kind of support you're going to need to provide, what to expect, how to help. If you think about breathing treatments, for example, not everyone would know all the steps involved in that. But if someone goes to, a respiratory therapist with you, or goes to a doctor's appointment, or listens into some of these conversations through NTMIR, they might have a better understanding of what all is involved in that. And so it's going to help you with your expectations, how to handle it, what to do. Ask for and accept help. So that and is really important. So you might be willing to ask for help, but are you willing to receive it? Like if someone offers, hey, I can, let me bring you dinner this week. If you say no, you're not really accepting that help. So being willing to accept it when it's offered or when you ask for it. So here it says, make lists of ways others can help, and let helpers choose what they would like to do. So even just reaching out to a friend or a family member and saying, hey, I'm really underwater here. I need some help. These are the things I have. Like, is there anything on here that you can help me with? And so it doesn't have to be like assigning people tasks. It can be a conversation. Like I mentioned, support groups for caregivers are really great. So there's an alliance called Family Caregiver Alliance, and this is for that informal caregiver type roles. And so this is for general support group for caregivers, but within most conditions, there's some specialized support groups for caregivers. I know especially within the Alzheimer's dementia realm, there's a lot of support for caregivers around that condition, just because of how challenging it is for caregivers. A great way to hear other people's stories, share tips, and just get some general support from people that may be in similar positions to you as you. Getting organized, so making to-do lists, setting a daily routine, just getting a better handle on what you have to do so it can feel less overwhelming. So you can look at it from, an objective, step back from it, look at what you have to do, break it down, make it a little bit more manageable. And then these last two items, I can't stress how important they are, but taking care of your own health and also getting regular checkups. So not skipping your own care for someone else's care. And so finding time to be physically active, I'll talk about that, just prioritizing your physical health and your mental health, but then making sure you're getting in to regularly see your own doctors, even if it's just for, checkups and things like that, because that's really where these chronic health conditions can creep in, is when you're not really paying attention to your own health because you're so focused on someone else's health. And so there's an interesting statistic here that caregivers report that positive activity are reduced by nearly 30% as a result of their caregiving responsibilities. And so again, this isn't necessarily, the fault of anyone. This is just, a time issue and a prioritization issue. So really, I like to compare, prioritizing your own needs, like refilling a cup. So imagine that you have an empty cup. How can you take a drink from it, or how can you offer water to anyone else if it's an empty cup? And so taking that time to really make sure your cup is full, or at least as refilled as you can. And I think a common issue people run into is that self-care, or making yourself a priority, can feel selfish if we, are attending to other people's needs. Or it can feel particularly challenging to engage in that kind of self-care when we're under a lot of stress, or we have a million things to do. And it's like, oh, this is just one more thing I have to add to my list of things to do. We don't have enough time in our day. but that really doesn't negate from the fact that it's so important to really, even if it's just for a little bit of time, find some time to replenish yourself. Keeping in mind that you have to invest in yourself or keep that cup full to be most helpful to yourself and to others, especially during busy or stressful times. If you let that cup run empty, you're going to really suffer the consequences. So I'll ask you all in the chat just to make this a little bit more interactive, but have there been times when you let your cup go empty? And, if so, how did it impact you? If you just, kind of let your needs go or didn't engage in anything that you used to enjoy, maybe because you couldn't find the time or you weren't prioritizing it, what kind of impact did that have on you? And if no one speaks up, I'll share my own examples, but I thought I'd see if anyone else has anything to chime in first.
You can put your comments in the chat if you'd like.
Yeah, it's a little like speech bubble that says chat. You can type in. So, oh yeah, thanks, Amy. So she showed you where you can type in your comments if you want. You don't have to, just if we want to make this a little more interactive. But, I know in my own life, I'm very busy, with my own family, with career. And, if I don't spend time for myself, I'm miserable. Like I'm grumpy, I'm less enjoyable to be around, I'm sure, to all my family and friends. I feel just drained. Like I don't feel as focused in my job. I can notice some real effects. And so, Jennifer, you said you get very overwhelmed. I think I do too. Like if I let this cup run empty, I'm more likely to feel more overwhelmed, which is this vicious cycle, because then I feel like I have less time to do things for myself. And then I feel more overwhelmed, and it just keeps going around and around. So I think, even if you didn't type in a comment, I think everyone can relate to a time in their life when maybe they didn't attend to their own needs and maybe experience some consequences with that. And so one way to override that is to look at your self-care. So how are you prioritizing yourself, even as a caregiver? And are you doing enough? So are you refilling that cup? So I really recommend doing something for yourself every day, even if it's small, no matter what. Like this is a goal. This has to be a goal. And being deliberate and intentional about how you. So some of you may have heard of Brene Brown. She's a social psychology researcher. And she talks about, the harm of pushing through when we're really exhausted and overwhelmed. Like there's too much to do, too little time to do it. And so she talks a lot about slowing down rather than pushing through, and being deliberate in your actions. I remember she had this example in one of her books about how she was supposed to be working on, some sort of talk or something. And instead she was just finding herself scrolling through social media or just idly scrolling through things on the internet. And it wasn't relaxing or productive, and just made her feel worse. And so she allowed herself permission to step away from the work and to do something that in that moment she felt would help her feel a little bit more replenished, a little bit more refreshed, a little bit more relaxed. I think she chose to go see a movie or something that she had been wanting to see. And so she was intentional in that moment. And so you could think that both activities are, giving yourself some time to kind of get away from your daily chores or, daily activities, scrolling on social media or watching a movie. They're both kind of extras, if you want to call them that. But one was intentional and one was not. And so really, when we make our self-care deliberate and intentional, it doesn't necessarily have to be anything new. So if you, play some, little game on your phone, and that's what you kind of do to unwind, great. It doesn't mean you have to change that, but make it intentional. You're going to set aside, some time at the end of the day to just kind of sit back, play on your phone, do whatever. Like being deliberate about it can make a real difference with self-care. And so here, there's a list of different activities that you could try. I always recommend trying something new. Like if you're feeling particularly stressed or overwhelmed, time for a change, time to try to shake it up a bit. And so you'll notice that some of these things aren't huge, time sucking activities, like playing with a pet, my cat. I could pet Luna any time of the day for a few minutes, and that's that, I would enjoy that. So, it doesn't have to be these long activities that you have to find a lot of time in your day to schedule in. It can be little things, calling a friend, reading, playing with a pet, giving someone a hug, stretching, just little intentional ways to give to yourself. And so I really like this image here because it's another way of looking at self-care instead of actual activities, thinking about overall categories of how self-care can look. So, self-care can be asking for help. It can be spending some time alone, just saying, look, I need, 30 minutes on my own to just kind of decompress. That's self-care. Putting yourself first, asking for what you need, setting boundaries, saying no, like that's definitely self-care. Forgiving yourself, taking a step back, like these are all things that you can do to care for yourself. When we talk about physical health and your physical needs, just some quick little suggestions. So staying active, and this doesn't have to be big exercise, going to the gym for 2 hours every day. This can be stretching, if you're sitting a lot of your day, getting up and moving your legs. Like this can be little mini exercise breaks throughout the day to just move your body. Getting enough sleep. So I have a whole presentation or webinar that I've done on sleep. And so if you have sleep issues, I highly recommend either listening to that or reading up on how to get better sleep because there's a lot of tips out there. But really aiming for 7 to 8 hours a night. Your sleep needs do change as you age. So it might be a little more, a little less, depending on your age. But I had to put in here not spending too much time awake in bed. So I think that's the mistake sometimes people can make without launching into my whole sleep tips. But, like let's say you want to sleep 8 hours a night, but you're really only sleeping 6. That doesn't mean trying to get into bed 2 hours early because you're just going to lay there and toss and turn. So you have to start where you're at, but then you can slowly add in a little bit more time if you're not getting enough sleep. Trying to go outside every day. So there are benefits of sunlight, even if it's not direct sunlight, just opening your blinds. Here it says for 10 minutes in the morning. There's some research in the sleep side of things that getting 30 minutes of sunlight in the morning around when you wake up can help set your circadian clock, which is your internal clock that regulates sleep and wake. So either way, just spending some time in a bright area of your house or sitting outside, having some coffee, something like that to get a little bit of sunlight. And then fueling your body with nutritious food and enough water. So it sounds silly, but water intake is honestly a small thing that's very easily controlled that can really help you feel a lot better. So I'm sure, the nutritionist can talk way more about this than I could, but, just making sure, like, if you're feeling really run down, how much water have you had today? When's the last time you ate? Little things like that can help you feel a lot better. Taking care of your mental health. So I'll talk more about specific stress management skills, but just in general, one thing that you can do is if you're feeling frustrated, manage that. So manage stressful moments in your day-to-day, whether it's from caregiving or another type of stress, but knowing when to take a step back, because pushing through in a time of high stress, in a high stress moment, if you have the ability to take a step back, of course, not every situation you can step back from, if someone's in immediate need of help. But there's a lot of moments when we can, that we just kind of override and just kind of put our heads down and try to push through. It doesn't mean you have to give up on a situation, but just pausing and taking a few breaths. That makes stress a lot more manageable emotionally. And then planning ahead for times that could be particularly stressful and how you're going to manage it. So coping ahead. That's a skill that we talk about in the mental health field, is learning how to cope ahead. So knowing if you're going into a situation that's likely to be a high stress situation, taking a loved one in for a procedure that you're worried about for them, that might be a stressful situation. Care of yourself. If you're sitting in the waiting room waiting for your loved one during a procedure, what can you do to, help yourself emotionally? Whether it's bringing a book along, calling a friend, whatever it is that you need, just kind of thinking ahead of it so you're not stuck in that situation with no coping skills. I already mentioned this, but learning to set boundaries. So especially learning to say no to non-essential demands on your time, or things you don't want or need to do. So we end up doing a lot of things based on obligations we feel, not necessarily things that we have to do or things that we want to do. So wherever you can, shaving off some of those responsibilities. If you're a caregiver, you already have a lot of responsibilities. What can you get rid of that's not essential? So being protective of your time and energy by setting these boundaries. And then, I'm biased. I'm a therapist or a psychologist. I obviously think counseling is effective and helpful. There's a lot of research that supports it. It's not just my own personal opinion, but I think anytime you can reach out to a professional just for some extra support, if nothing else, it can really help with those feelings of being overwhelmed. It doesn't have to be that you're clinically depressed or have a clinical diagnosis of an anxiety disorder. It can just be that you're really struggling to take care of yourself day to day, or you're dealing with a lot on your plate. Having that, objective third person or, objective other person in your life to kind of vent to and to troubleshoot, problem solve, come up with some strategies, I think that can be helpful for anyone. And it's much easier to get ahead of things than to let it develop into something like a full-blown, anxiety or depressive episode. Obviously those are treatable too, but it's just, going to be a little bit more work at that point. So if you can get ahead of it with some coping skills, you're going to be, better off. So there's a great website here, psychologytoday.com. I use that, professionally to recommend, for how to find a therapist. I also use it in my personal life. If a friend or a family member asks me for, advice on how to find someone, it basically, you can type in your zip code. And then once you search your zip code, you can filter it by your insurance. So Medicare or whatever your private insurance is, you can filter it, and then it'll show you a list of everyone in that area that takes your insurance. So I think it's a lot more helpful than reaching out to your insurance company. Obviously, they can provide you recommendations too, but often you just get names and numbers. You have no idea, if they see children, if they see adults, if they're psychiatrists, if they're psychologists. On this, you can read, they have like little bios and pictures, so you can just read more about the person. Or even if you get a list of people from, a primary care doctor or your insurance, a lot of times these people will have profiles on Psychology Today, so you can look them up and read a little bit more about them. And so the last thing that I'll focus on today is some specific stress management skills that can help for caregivers or really anyone. Caregiver stress, while it has some unique features, it also overlaps with a lot of other stress in people's lives. So like I mentioned, this isn't just a plug for my own content, but I did do a stress management webinar, so you can listen into that. There's also no shortage of stress management, talks, support groups, stress management treatment. So you can definitely find resources out there. One of my favorites personally is this grounding technique. So if you're feeling really anxious or worried or stressed, oftentimes we get really caught up in our minds, thinking about the situation, worrying about the future, thinking back to the past and kind of ruminating or going over it again and again. And so we lose touch with the present moment, with what's going on around us. And so this is a really simple way to just ground yourself back to the present, out of your thoughts of the stress and back into the moment. And so it talks about a 5, 4, 3, 2, 1, but you can also just pick out one thing of each of your 5 senses. So I'll try this multiple times a day in my own life. Okay, what do I hear? Like I'll pause and kind of listen to what's going on around me. What do I see? Just kind of taking inventory of what's going on around me. What do I feel? Sometimes can I feel the shirt on my shoulders? Can I feel my glasses on my face? Maybe I'll kind of like press my fingers together to feel that. What can you taste? What can you smell? So just kind of connecting back in through sensory information into the present moment. It's part of mindfulness, if you've heard of that before, and that's been linked to some great outcomes for stress management. Breathing, another one that I like to recommend to people, learning they call it belly breathing or diaphragmatic breathing. So learning how to take these deeper breaths through your belly. So kind of filling the air in your stomach and allowing it also to fill in your lungs, taking that deep breath, can have a lot of good benefits for de-escalating a stress response. So even if you don't do something super formal, just like taking a slow inhale and equally slow exhale, just one of those can be great for de-escalating that stress response. Social support. So you need if you're a caregiver, you need your own social support. This may overlap with your loved one's social support, but you also don't need to give up your own, networks of social support because you're a caregiver. So lean into your social support. It comes in many different forms. And so oftentimes it's important to match what kind of support you need with a given situation. So, it talks about here, emotional, informational, tangible. We all have those friends and family members in our lives that are great at problem solving. They'll jump right into advice. And then we have ones that are better at the emotional, kind of listening, letting you vent, being there with you. And so depending on what you need in that situation, if you just need someone to listen to, reach out to that person who's a good, ear. If you need some advice, reach out to the person that's a good problem solver. Research really, though, supports quality over quantity. So don't feel like you need like a whole army of people in your life to provide you support. Even if you just have one reliable person in your life, that makes a huge difference. I have to stress this again, but being open to not only asking for help or asking for something, but also receiving it. Remember that you don't have to manage everything yourself. Maybe there is a lot of things you have to manage on your own, but there is undoubtedly something you don't have to manage on your own. So in summary, basically, you and the person you're caring for deserves the best version of yourself, well-rested, stable, supportive. And in order to be the best version of yourself, you have to invest in yourself. You have to give back to yourself. Whoever you're providing care for, they don't want you to ignore your own needs and end up exhausted physically or mentally. That's no one's goal. And there are ways to balance this, to be able to care for someone else and to be able to care for yourself. It's about how to do that. Sometimes it's an adjustment from what you were used to if you haven't always been a caregiver. Noticing signs of caregiver stress so that you can get ahead of it, so that you can stay happy and healthy while still being that caregiver in your loved one's life. And then refilling your own cup. I can't stress that enough, but it allows you to give more to yourself and to others. I do want to end, though, before I take any questions, with this disclaimer. I kind of started out with it, and I want to finish with it too. This presentation and this information does not mean that if you're someone with a chronic health issue, you should stop asking for and accepting help from loved ones. Not the goal with this presentation at all. Most of us, we want to help our loved ones in their time of need. You need support when you're dealing with a chronic illness. If you try to deal with that on your own, it can be really overwhelming. And so the support is important. feeling stressed or sad or whatever emotions a caregiver may experience is a normal, common part of the process. And just because they experience these emotions doesn't mean that you necessarily need to change how you're receiving help. Whether you're the person receiving the help or you're, living with someone who's receiving help or whatever the situation is, it's not necessarily about no longer helping someone. It's really about shifting priorities, making sure that the caregiver is still prioritizing themselves while also providing the care. There's ways to get and give help while meeting both of your needs. And so it should really be a give take and, accepting support, giving support, attending to both of your needs as much as possible. And communication is really key with that. So, if you're a caregiver opening and you have the ability to talk with your loved one, opening up about, feeling overwhelmed, but also saying, you want to provide this care, just keeping that communication line open so that you can get ahead of this stress and you can deal with it as it comes on. So I just wanted to throw that out there because I certainly don't want this presentation to act as a barrier to getting the support you need, because I don't think that's the answer either. It's really about balance. So, all right, and that's my presentation for you all. Any questions, thoughts, concerns, comments?
You can drop your questions into the Q&A, comments and concerns into the chat. Here we are. Somebody is asking, I'm dealing with parents who were super smart, but are now dealing with different levels of dementia. Is there any written references you can recommend?
Can you just elaborate a little bit more, like written references for like dealing with caregiver stress or dealing with a loved one with dementia? Is that, if you can just like follow up? I think that's what you're asking for, but I can definitely provide some recommendations. Off the top of my head, I don't have like a list of recommendations, but I think it's the Alzheimer's Association. They have, and it's not just, oh, I'm a caregiver, but need more knowledge. Okay. So let me just double check here. So yeah, Alzheimer's Association is a nonprofit organization. I have a family member who also has dementia, and my cousin who's the caregiver, she's found great support through this association. And so it's not just, individuals dealing with Alzheimer's. I believe it's different levels of dementia as well. And so they have help, support, research, all types of reading about it. And so I would highly recommend, going to their website. I think it's alz.org.
It is.
Yeah. Okay.
Get that in as an answer. Okay. If there are other questions or comments, now is the time to drop them in. Okay. I'm not seeing any others. You can always email us if you have any questions, and we can pass those on. But
sounds good. Yeah.
Yeah. Thank you, everybody, for joining us. We have another webinar coming up, I believe, in June with Dr. Smith, and we will be shortly announcing our next nutrition webinar in May. We appreciate you joining us this evening. Everybody have a wonderful week and a wonderful weekend next week. Thank you. Thank you, Dr. Smith.
Of course. Take care, everyone.
Take care.